Hi, I'm Kelly Moore. I work for Nationwide at the Nationwide Retirement Institute, and I've been building educational content about retirement for years. Even though I'm surrounded and I talk about retirement all day, I didn't always have a plan for my own retirement. That is until I started really listening to some of my friends who are close to their own retirements or in retirement. For years now, I've golfed with the same group of ladies. I've been the youngest by 15 years for the most part, and about half my group is now retired. After we golf, we go to dinner and we chat about what's going on in our lives off the course. And over the years, I've just learned more and more about how their healthcare costs have changed and how much stress healthcare is on their lives. And that really got me thinking. So when I hit 40 and after listening to all my friends, I realized there were a couple of things I could be doing to get ahead of my future healthcare costs, particularly in retirement. I started investing more in my health savings account through Nationwide, my employer. And the reason the HSA made sense for me was because I had a high deductible healthcare plan already, which is required to have an HSA, but I can contribute to it via my payroll, which makes it really easy for me to save that money, and it comes out before tax, pre-tax, which is great because I don't have to pay taxes on it now, and then it also grows tax deferred. In addition, funds from HSAs, if used for qualified medical expenses, are tax-free coming out. And hopefully, that's a very long time from now, but also a benefit to me. I also created a separate savings account that is my emergency plan. I have written out my plan so that my family knows what I want them to do with the money in my HSA, emergency account, and other accounts. And it sometimes when I talk to my younger friends about my plan, they think it's overkill, but for me, it isn't. It only took a half hour to just put my thoughts down on paper, and I really feel so much better having done that. And there is a lot of paperwork that comes from having a plan and managing a multitude of accounts that I have, but I try to sit down once a year, make sure everything is printed out in a nice folder at my desk. I go through documents, toss out or shred what's out of date, and keep copies in there of things like my statements and my will. So finally, the best thing for me has been I have watched some of my golf friends slow down. We've even had a few ladies leave the league who've decided they just couldn't keep up to a full-time league. But I know I want to keep golfing and being active for as long as possible. So I've decided to focus on my physical and mental health for now, which to me, I used to be a runner. It's really shifted to more walking and yoga and stretching, and of course golfing, and really learning how to manage stress and anxiety with so much that's always going on. So, I used to blow past kind of mindfulness and working out and things like that. But once I realized how important those things might actually be, just as important as the other steps I'm taking to prepare for retirement, it really helped me to prioritize those in my life. I know these steps are some of the first I'm just taking, but it feels good to have some of this already worked out. And in a few years, I know I'll need to make decisions on other things like planning for long-term care, especially experiencing that with my mom now, and how I'll plan and save for that. But at least I'm off to a great start, and that feels pretty good. If I had to remind people of some things, Medicare is an important part of healthcare, but it doesn't have to be the only part. Consider a health savings account to save for health-related expenses during retirement. Make an emergency plan is another way to ensure that you and your loved ones know what to do if your health changes, and make sure you're caring for your own physical and mental health now as an investment in your future well-being. And finally, talk to a financial professional. I work with them on a daily basis. And if you need help thinking through the right options for you, a financial professional can do that.